Dr. Rao, who's an interventional cardiologist. Dr. Rao, let's talk about mitral valve disease. What is that?
In order to understand mitral valve disease, we need to understand what the valves do in the heart. We have four main heart valves. They basically act like one-way doors to prevent backwards flow through the heart so that the heart pumps blood only forward. The mitral valve sits in the main pumping chamber of the heart, the left ventricle. When the heart squeezes, it prevents blood from going backwards into the lungs. So any condition that makes the valve too tight or too leaky is mitral valve disease.
Who's at risk for mitral valve disease?
If you've had a previous heart attack, the heart muscle can weaken and dilate over time. That can cause a leak of the mitral valve. You don't necessarily have to have a heart attack to be diagnosed with congestive heart failure. You can have a leaky heart valve in that condition as well. There's also a fairly common condition called mitral valve prolapse, where the valve, when it closes, bulges backwards and can promote leak. So patients that have had previous heart attacks or just been diagnosed with congestive heart failure or mitral valve prolapse are at risk. I see patients complaining of shortness of breath, and that's because the leaky valve allows blood to go backwards into the lungs. Patients can also have fatigue or just decreased exercise tolerance. Those are some of the first warning signs. Traditionally, the only treatment has been open heart surgery, where the surgeon has to make an incision in the chest, either repair or replace the mitral valve. Now there's a minimally invasive technique called the Mitral Clip. What this involves is putting a tube into the vein in the leg, advancing that into the heart, and delivering a clip. It looks kind of like a clothespin right onto the valve to reduce the leak. Patients can actually go home the next day from the hospital. Compare this with an open heart surgery where the hospital stay could be a week or more. This is actually a revolutionary treatment. It makes patients live longer, keeps patients out of the hospital, and also keeps them feeling better.